Patient was placed in the supine position. We used a tourniquet and attached a counter support to the thigh under joint distraction with an ankle distractor, Smith & Nephew Spider limb positioner. Preoperatively, ultrasonography revealed a detached talar bone fragment and anterior talofibular ligament (ATFL) deflection. The ATFL, fibula and talus were marked using ultrasonography to confirm the ligament footprint's location. A 2.7 mm 30-degree arthroscope was used. Medial midline and anterolateral portals were created for viewing and working, respectively. There was no articular cartilage injury or degeneration. To evaluate the ligament quality at the talar ATFL attachment, accessory anterolateral portals were created for viewing and working. Evaluation of ligament quality using a probe revealed no ATFL injury or degeneration in the fibular region adjacent to the ligament attachment. ATFL tears were present at the talar footprint, and the ligament tissue was attenuated with small bone fragments, which were removed. The far accessory anterolateral portal was placed directly above the talar footprint under arthroscopic, ultrasonographic, and fluoroscopic imaging. A suture anchor guide was inserted through the far accessory anterolateral portal, drilled into the talar footprint in the medial malleolus direction, and a suture anchor was placed at the talar insertion of the ATFL. A suture fibre passed through the entire ligament using a suture passer that penetrated beneath the ligament. While lifting the ATFL, knotless sutures were tightened and elongated ligament was advanced in the ankle dorsiflexion position.